Hi there, I'm Lucy Macdonald, Physiotherapist. Welcome back to my virtual clinic. Today, I'm really excited to introduce you to Morna, who's going to tell us all about how she recovered from her knee pain caused by osteoarthritis. So, Morna, welcome to the virtual clinic. Tell our viewers a little bit about what was going on when you and I first met and you had the knee pain. How was it affecting your life, that sort of thing?
Lucy, it was just increasingly affecting my life. Many years ago, there was a leg injury when I damaged the leg, but the knee was becoming more and more painful. And also it was reducing my confidence. Going up and down stairs particularly was a scary thing because I just wasn't quite sure it was going to hold. So I went along to the GP and he said, yes, knee x-ray, had an x-ray. It was confirmed that it was a moderately arthritic knee. And I just at that point thought, well, this is arthritis. I'm going to go downhill. But fortunately, I heard of Lucy, met up with Lucy, and we have progressed from there.
Okay.
But it was mainly confidence in moving and the assumption that it was just going to get worse.
And I think that's really, really common, and that's something that I know we were both keen to make this video to really share the fact that arthritis, even if you've been given a clear diagnosis of arthritis, that it doesn't mean that you're going to progress downhill. It doesn't mean that you're going to find walking progressively more difficult and end up not being able to do day-to-day things. Because I think that's a really common misconception. And I don't want to dwell on it too much, but when you first got that diagnosis, it can feel, or can you explain how that felt?
Well, firstly, it made me feel older. So that, and there was a part of me that was just saying, well, I have to put up with this because I'm getting older. And secondly, yes, it made me a slightly, not dread, but just think of all the things that I wouldn't be able to do in a year or two because of this arthritis. And clearly it was going to progress. And there are all the things that I love to do, which is like walking and gardening and playing with my grandchildren, I wouldn't be able to do because of this arthritis. And it was just, that was the fear. There was a fear. You try hard to put it in the back of your mind, but it dominates the fear of progression and inability. Yes, a loss of independence, a loss of freedom to move.
And I think that a lot of people watching this will be able to relate to those things. And what I see from a physio perspective is that fear then feeds into people doing less and less with their knee. So doing less exercise, thinking that by doing less exercise, that's going to help prevent further pain, when actually we know from a scientific perspective, and certainly you're a very good case of this as well, that we know that arthritis responds well to exercise. We will of course get onto that more in a minute, but I wanted to also pick out one of the things that you said about feeling old. Now, again, I think there's that element that people think, oh, arthritis is just something that happens when we get old and it's sort of inevitable. But I think, what would you have to say about that?
Well, yes, I think exactly that. I think it is, and it is almost bred into you that as you get older, you'll be able to do less. And one of the reasons is that your joints start to hurt. And you're absolutely right, Lucy, in that as it got worse, I did less and less. And I didn't make the leg go upstairs energetically. I crept up and I crept about so as to protect that joint. But and sort of thinking of all the other joints as well. But no, I think, and I also think there is a thing in our generation, or my generation, is, well, you must put up with it. And actually, as you've shown me, you don't have to put up with it. You can move on. But no, I think the protection of a painful joint is very significant, because you do instantly not move in certain ways, you don't use it in certain ways, just because the pain is a constant reminder that it's not good.
and we know from a physiological perspective that that movement does a multitude of things. It helps the joints to stay healthy. It obviously keeps your muscles strong. It keeps your circulation going, and has lots of other health benefits as well. But particularly for arthritis, it's excellent. And I certainly have seen plenty of people in their 80s, even older, who are super strong.
Yeah.
And you know, I remember when even when I was a junior physio, and I was working in a elderly care home, and I remember seeing a class and trying to a class of people doing some exercises, and then trying to do the exercises myself, and it was a real struggle to lift some of the things, and it really gave me that insight into, it doesn't matter how old you are, the muscles have an amazing ability to get strong, and yes, it takes longer as we get older, but it is still entirely possible. So yes, I hopefully that's helpful for people watching this. So onto the sort of exercise side of things, can you tell us a bit about your experience with that side of things? How did you go about it? Because I know there were some negative experiences that you were faced with at the beginning, which can be quite common as well.
Well, yes, I mean, and I'm very fair to everybody. Everybody is doing their best, but the GP referred me to the NHS Physio. I rang them. There were, partly because of the current circumstances, there were no possibilities of actually seeing anybody. They sent me a sheet of paper with lots of different exercises on it, and said I could phone them if I was in difficulties. Well, it was helpful, but it didn't actually start at the beginning. It didn't take me back to understanding the joint and understanding the importance of starting slowly. I mean, it was just do this 20 times a day, do this 30 times a day. And I tried, and of course it left me jolly painful knee. And there wasn't an emphasis on begin at the beginning, get it right before you start, get the exercise right. So there was no, and that may have been partly the current circumstances and restrictions, but there was nobody to check that I'd got the angles and the exercise correct. And I did actually ring them and ask whether they had videos or a website that I could go, or YouTube that I could go on to watch somebody doing these, but at that time they didn't. So I was just on my own, and it therefore slightly put me off doing the exercises, because I was left in a lot of pain and a lot of discomfort, and apparently no real improvement. So yes, it wasn't a good
common. I think that's a really common frustration, is that people sort of they see, you know, in media, perhaps mainstream media, that exercise helps arthritis, so people go and try some exercise, and then it's painful. So again, that they then stop, and then we kind of hit that negative spiral of reducing activity and exercise. So luckily you and I met, and we commenced some virtual physio sessions. But I want to focus on what you've just mentioned with regard to the exercises that I sent you that were videos and are free and freely available on the Octopus Clinic website, because I recognize that most people can't afford to have private physio, so it's really important for people to know that there are videos that they can access on the Octopus Clinic website for free. So please, could you share a bit about what the difference was between just having a sheet? You've sort of mentioned a bit about taking it back to the beginning. What do you mean by that?
Well, because once you and I had spoken, and I'd understood a little bit more that it wasn't the end of the road for a knee joint, I then went on to your site and watched the videos of the exercises. And what I mean about going back to the beginning is it was so clear that you had to start by getting alignment right and getting the way that you did the exercises right. And by watching them with demonstrations from you and your colleague, it was so clear. Each video was extremely clear as to how you should approach it and what you should do. And it really made a difference, because I then started by getting alignment right, we're getting the body in the right place, and understanding from the dialogue that you produced, understanding why that had happened before you got all excited about doing exercises. And then by going, and also the whole of your video and the program that you issue on YouTube's is or on your website it's very, very clear to progress very slowly from one exercise to the next exercise, and not to move on until you've got it right and it's beginning to be effective.
Yeah.
And you can feel when you get it right if you've really watched it.
Yeah, yeah, yeah.
So no, the website and the videos that you produce are absolutely crucial to the way I've managed to get on top of that.
So I think that's why we created them, basically, because and I think there's three things just to pull out from what you said. The first one actually is about the education around what the knee joint is, and there's a whole series on our website that talks through, and on the YouTube channel that talks through, you know, the structure of the knee, what could be causing your pain, etc. So it's worth watching those first, from the sounds of it, and then going on and looking at the exercises. And I remember you particularly talking about the crosses on the feet and the knees in those videos being quite helpful to really be able to see how to move. And then the third thing being absolutely essential is to start small and to build up in little increments. And then the body has a chance to recover and repair. So that's really helpful. And actually, on that note, the other thing that I know that we talked about as well is the other things that help the body to repair. So really making a strong focus on getting all the right nutrients into the body, managing stress, getting enough sleep, all of those different things, which again, there's another video on the channel about all the things that you can do to recover. So it's worth people watching that video as well, because all of those things feed in positively to recovery. So yeah. One of the things that you are really excellent at, and I know that a lot of people struggle with, in fact everyone struggles with it, there's not a single person that doesn't find it difficult, is creating new positive habits. So actually making the time to actually do the exercises, to remember to do the exercises. What tips do you have for people on that topic?
Well, firstly, I think belief. You have to know that, yes, so that is part of the other videos that you were talking about, because you have to believe. But secondly, there is only one way I know that I would have done these exercises, and that is to designate a specific time. In most people's lives, there's always something more important to do at that particular moment. But if you say, no, I cannot go and do, and absolutely decide on what the convenient time to please yourself each day. And it is a bit of, it's a self-indulgent time in that you're going to give it entirely to yourself, but that's part of getting stronger again. And so you designate a specific time in the day when, for this 10 minutes, 15 minutes, whatever, I am only going to do exercises. And almost at that same 15 minutes, you sort of clear your mind of other things. So you take out whether the laundry needs doing or whether you've got 150 emails from work. You just give that 15 minutes, but it has to be a designated time and every day. And if you start missing the odd day because you're too busy, it's really the end of the road. It's, you know, if you can make an excuse one day, you'll make an excuse lots of days. So it has to be a cast iron designated time, which is exactly what I did when I decided, yes, Lucy is talking sense, that the videos show me it can get better. So I thought, fine, this is going to be worth it. I need to set aside this time. So chose a time that suited me. Yeah. So it is really important, I think.
There's something that you mentioned just then that will have played significantly into your recovery, and that's for fear of using a word that's banded around far too much, that's the mindfulness of the way that you did your exercises. So the fact that you were focusing on your exercises and allowing your brain to feel what your body was doing, that's really important in recovery. And the other thing that I know that you did was that you tagged your exercises onto I think one of your husband's already established habits from memory, and that we know is an incredibly good way of developing a new positive habit. So we know that if for example we clean our teeth every morning, and we know that we tag our a new habit onto that, you're much more likely to sustain that habit than if you just than if you're just choosing a random time. So,
Yeah.
so that's worth bearing in mind for people. But I am going to do my next video is going to be on lots of different motivational tips. So I'll cover that in a video in my next video. So Morna, it's been absolutely amazing talking to you. Is there anything else that you would like to say to people out there who are currently suffering with pain due to arthritis before we wrap up?
Only the result, Lucy. I was unable to walk downstairs without extreme pain for a start, and holding the banisters because I was scared that the knee was going to give way and lock underneath me. I can now run down the stairs, and it is solely, nothing else has changed in my life except for the fact that I've done the exercises and will continue doing them, because I still know it's got to get stronger.
Are
but
you still whizzing around the garden?
It's still running around. Well, I couldn't run around the garden when it was bad, but now I run around the garden.
Brilliant.
And I joined Joe Wicks for his exercises as well. So I tagged it all together.
Would it be fair to say that it would have been impossible for you to imagine being back at the levels of exercise that you're currently at back in the days when you had all that pain?
Absolutely. And certainly the fact that the fear of moving around, getting up and down out of a chair, all those things were so I think discomfortable. Yeah, and they're not anymore.
Yeah, which is hopefully exactly the right note to end on, because hopefully it gives people hope. So anyone that's watching this who is in pain, it's please do see that little flame of hope, and please do go and check out the website and have a look at the videos, and do get in touch. So the best way of getting in touch with us is reception@octopusclinic.com, but also check out the other videos on YouTube, and every Friday we run a Q&A session on Facebook, Twitter, YouTube. So please do, if you want to ask specific questions about your pain or injuries, please do join us then. But again, thank you very, very much for joining us, Morna. I think many people have found this very helpful. So on behalf of me and everyone watching, thank you very much.
Thank you, Lucy.
Take care. Bye.
Bye.